Hey, Mr. Rajesh, where you want to go?
Uh, I have told my doctor that I can go back home today. I already discharged.
Okay, I see. I think the pharmacy down there is too noisy, and I think it is my responsible to explain to you about your medication. So, have a seat first, sir.
Okay.
Okay, sir. I already checked your case note, and the doctor say you can discharge. So, regarding your medication that the test prescribed, you got three medication, which is first the hypertension medication, second diabetes medication, which you familiar with it, and lastly cholesterol medication. So, the hypertension medication is to lower your blood pressure to normal range, which is 120 and 60, and to slow progression of your renal disease. While for diabetes medication, it is to maintain as well your blood sugar level to normal range and to avoid tissue damage. And lastly will be your cholesterol medication, which is to lower the blood cholesterol. So let's go through one by one. Mm, your first medication, for you have one medication for hypertension, which is Ramipril 2.5 milligram tablet, and you have three medication for diabetes, which is glycoside and metformin. I believe you know these two, and the doctor prescribed one another to combo with the metformin, which is vildagliptin, and lastly is the cholesterol medication, which is simvastatin. Okay, for Ramipril, which is the hypertension medication, you need to take one tablet twice a day, and you need to take it at the same time before you sleep. The reason why you need to take this medication before sleep, because this medication will make you to feel sleepy, and you need to avoid taking this medication before you drive it, because it might lead to road accident. And you must be alert of the side effects of this medication, which is first dry and ticky cough that does not get better, and dizzy or lightheaded. Alright, so let's go to your diabetes medication. T-glycoside, you have to take two tablets once a day. Take it with your breakfast, and alert of the side effect, which is vomit and nausea, and also diarrhea. Your second medication for diabetes is metformin. You also need to take it at two tablets, but it is twice a day. It's different from glycoside, and you need to take it with meals. And the side effect of this medication is stomachache and also diarrhea. And the last medication that the doctor have add another medication for your diabetes condition, which is tividogravity. You need to take one tablet once a day, post meal. Alert of the side effect as well, which is constipation and headache. And then lastly would be your cholesterol medication, which is simvastatin. You need to take one tablet once a day at night, and take it with meals. You need to alert also for the side effect, which is headache and stomach pain. So I'm going to demonstrate for you. This is just knowledge for you, of how you administer your medication, for how you calculate your drug dose. So for example, the doctor have prescribed 1 to 100 milligram for you, and available for this medication is only 60 milligram. And by using this formula, you actually get two tablets. So that's why here you get two tablets. And for 7 right of administration of medication, which is you need to confirm that you have right drug, right dose, right time, right patient, right route, right technique, and documentation. But for your cases, you need to confirm only three medication, which is your drug, your dose, and your expiry date, because most of these have stated at the medication lah, but you need to make sure as well whether you take it at right doses and at the right time. Okay, so do you have any question for this medication that I've explained?
I want to ask about my hypertension medication, which is Ramiprin.
Yep.
Just now you say that I need to take one tablet twice a day
Yep.
before sleep.
Mhm.
So does it mean that I need to sleep 2 times a day?
No, because it works like this. You take before sleep. Let's say example 10 p.m. you sleep, and then the other cycle is 10 p.m. also. It's still not a day. Uh, this is actually 2 times you take it in a day, because it is actually not considered as one day already. So that's why I need you to take it at the same time to make the cycle is 24 hour. Get what I mean?
Okay.
Okay. So I need to assess your understanding. Okay. What is the purpose of the hypertension medication?
You need to lower my blood pressure to normal range.
Okay.
Which is 170 systolic and 60 diastolic.
Alright, good. And then for diabetes medication.
It is to minimize my blood sugar level,
Right.
so that I didn't go hyperglycemic.
Alright, good. And your cholesterol medication?
It is function to lower my cholesterol level.
Alright. So I need you to list your medication as far as you can recall.
I was prescribed with tablet Ramiprin, metformin, simvastatin, and I got one medication that I'm not familiar with.
Alright. Good. You know the dose of the medication that I have tell you?
Yes. The dose.
Okay. Good. And I believe you know how to administer the medication, right?
Yes. As far as I concern of the medication through order.
Yeah, good. And can you identify the side effect of the medication for hypertension?
For a few that I can recall is it might be lightheaded and maybe headache. Also, I will experience dry cough.
Okay, very good. Your adverse effect for diabetes medication?
Mostly, I think diarrhea, nausea, and also that's as far as I can recall.
Okay, good. You actually got half of it correct. And lastly, your cholesterol medication.
I will experience stomach pain.
Okay, good. And lastly, what will you check on your medication when you receive it from the pharmacist?
I will check for my drugs, whether it is right or not, and also correct dose,
Good.
and I should check the expiry date.
Okay. So, Mr. Rajesh, I believe you are completely understanding of your medication. So, my suggestion would be you can buy a tablet to make it your medication. You can monitor it very well by using the tablet.
You mean that the
Daily.
medication container that has day written on it?
Oh yeah, yeah, true. Okay. That's all for.
Correct.
Thank you.